Artificial intelligence technologies are making our lives easier in all sorts of ways, right? And that includes your skin care. Dr. Adam Mamelak from Dermatology is here with us this morning. Good morning to you.
Good morning to you.
So tell us, how are you using AI in your everyday?
Well, you know, artificial intelligence is now everywhere. I mean, think about it. It's completing our emails, it's scheduling our appointments. Half the times when I'm messaging someone, I'm talking to a bot. So it's inevitable that this has come to medicine. There are now a handful of applications. These are new that can very accurately and very reliably diagnose skin conditions and identify skin diseases on our body.
Wow, what type of conditions are we talking about?
You name it. Acne, eczema, psoriasis, even things worrisome like skin cancer.
Wow, and so how does this really benefit your patients?
Well, you know, skin diseases are not always straightforward. I mean, if you get a pimple, we know you have acne, right? But there are others that are much more subtle. Things that might need some sort of workup, a laboratory test, even a skin biopsy. Things that we don't want to miss, like skin cancer. These applications often offer a second opinion in real time. So when we're looking at a patient and we're suspicious of something, it helps verify our diagnosis, helps support our treatments, and helps focus our prescriptions that we write.
And this is really interesting because I think there are times that people don't realize certain types of rashes on your skin can indicate different types of cancers. There's been breast cancer diagnosed with rashes or things of that nature that may not be just as easy to detect with the naked eye.
Absolutely, and that's where these apps really come in handy. You know, these apps, though, they have to be used under supervision.
Right.
The only thing that I caution people is not to go home and think that they can replace their dermatologist.
Yeah, do not download an app on your phone and then think you can do what Dr. Adam does, right?
I think of it like Google. You know, I had a cough last week and I Googled my symptoms. Google told me within minutes I was going to die the next day. We've all been there. We've all made that mistake. These applications are very helpful in guiding us, in telling doctors where we should go with our patients. You know, if you had a mole that's bleeding, that might be a worrisome sign that you have skin cancer on your body. If you tell a doctor that you had nicked yourself shaving, well, we might not be as suspicious. These applications are limited, and they only look at that bleeding mole. They don't take into the full history, the full patient experience, that holistic view that we strive to do every day.
Right, but this also gives you, while it is limited, it can give you sort of a second opinion.
100%. And, you know, that's what patients are often looking for. They're nervous about something that's come up on their skin. They're uncertain about it. We can tell them things, but we want to give them that reassurance and that reliability. And this is one way to help support our diagnosis and our clinical suspicions.
Okay, very interesting stuff, and people can, of course, check out some of the stuff that you're using over at Dermatology, right?
100%. We're there all the time.
All right, Dr. Adam, thank you so much for joining us this morning. We appreciate it.
My pleasure. If
you guys missed any of this, we're going to upload this full interview onto our website, KVUE.com, after the newscast. We'll be